In July of 2018, I went in for a yearly mammogram. I had never had any problems with my mammograms. They were always normal. When I was 35, I had actually gone in for a baseline, and then from the time I turned 40, I went in for yearly mammograms religiously. I never missed one. After my mammogram, the day after, I received a phone call that I needed an ultrasound. I had never had that before. 2 days later, I had the ultrasound. The day after that, I was told I needed a biopsy. And on August the 20th of 2018, I received the news that I had breast cancer. I was in Dr. Elmore's office with my husband 3 days later. From that point, he spent an hour with us discussing options. I wanted a double mastectomy. I didn't want to have to go through and have mammograms every 3 months. So from that point, he agreed to do that, and I told him I wanted a reconstruction. He set me up with Dr. Hayes, and I saw Dr. Hayes a week and a half later and had my first surgery on September 19th.
4 years after her diagnosis, I had been lifting at the gym and really been focusing on my bench press, and I had a pain right on the left side of my breast, and I just kind of threw it off as I'm benching. I pulled something, and I didn't really pay attention to it. I'd had a mammogram with my best friend 4 years before, but that had been my last mammogram. As the pain, it just started bothering me, I just felt like, hey, I probably need to go get it checked out. So I scheduled a mammogram. After going through all of that with her, I wanted the same team. I wanted the same doctors. I wanted Dr. Elmore. I wanted Dr. Hayes. I saw the care that she received, and I wanted that same care. And so I set up an appointment with Dr. Elmore, and I went to see him. And just like with her, he spent so much time explaining things, calming me down. But I'm so thankful for the care that I have received at CAMC, and I tell everyone that. I am still a patient of Dr. Collard's here at the Cancer Center. I'm on tamoxifen, and he keeps up with me, and he's a good doctor as well. My whole family just cannot thank Dr. Elmore and Dr. Hayes enough for what they've done for me, and I just knew that they were the right team. And I have been in a couple different support groups online. That was my first thing, because I just wanted to see what other people said about it. And I see people, women that are at some of these bigger hospitals that are known for their cancer care, and they will be on there talking about infections and all these things that happen, and I just think, what in the world, that wasn't my care at all. And I just feel like how great is it that we have such a great resource here in West Virginia, in Charleston, local to me, so that I don't have to travel to those bigger cancer centers, and I'm confident in the care that I receive here home. And I'm very, very thankful for that.
When we're talking about breast cancer treatment, we have every option available to be able to do at CAMC, and we're able to do it very well. So there's really no question that the care that we can provide here is just as good as somebody would get at another facility.
These two ladies here is the whole reason why I do plastic surgery. I love kind of getting patients to this point. Ideally with a smile on their face. But I think that's what, kind of their whole journey, that's why, that's myself and Dr. Elmore, I think that's why we do what we do.